Okay. So here, 30-year-old man, cable person complaining of the inertness, memory problem, and pain in his limb. Objectively, he presented with skin failure, anemia, reticulocytosis, and basophilic stripping of the erythrocyte, high level of porphyrin in the urine. The man has sign of following disease. So, if you look at the the given question, it says that the patient is having some sort of some sort of something which is externally goes inside the body, and there's a complaint of the inertness, memory problem, and the pain in his limb. Okay, so inertness and memory problem, and also there is limb pain. These these three things, and here anemic symptoms are also very clearly visible. So this is the condition of the lead poisoning, and which is also known as saturanism. Okay, so now what are the, let's see about the other options. In other options, name itself, mercuryism, stand for the mercury, asbestos itself, asbestosis, beryllium, sideroblastic, where the iron involvement. This one is actually lead, where is saturanism. And affected organs, one by one we will see that if it is asked to you in the exam in the next question, then how you can differentiate. In case of mercury poisoning or mercury excess, so the patient will have the anorexia, tremor, weight loss, and there is a GI dysfunction. Asbestosis, lungs problem. So in asbestosis, patient will have the how to what will be given in your question. It will be the chronic stage of, and also prolonged exposure to asbestos. Exposure to asbestos. Now next one is beryllium. What stands for the beryllium? In the beryllium, it is a chronic, also it is a chronic disease. Most of them are actually chronic. So allergy, this is actually allergic type. And here the patient will say the chronic lung disease followed by the exposure of beryllium. So there is a secondary to pulmonary complications with allergy to the beryllium. Next one is a siderosis, where is a deposition of iron. So in this situation, there is a without use without qualification. So it is used for an environmental disease, lungs, known as significantly pulmonary or welder's disease, or the form of pneumoconicosis or citrosis. And other names are pulmonary citrosis, welder's disease. So most commonly known as welder's disease. Okay. So saturanism stand for inertness, memory problem, and limb problem. In mercury, in the mercury problem, you will have in the mercury poisoning, you will have the anorexia, tremor, weight loss. In asbestosis, there is a pulmonary condition, chronic exposure to the asbestos, and beryllium, chronic exposure to the beryllium, secondary pulmonary, cedro, where there is deposition of the iron, most commonly Welter's disease. Okay, now move to the next question.